there's this thing called mast cell activation syndrome. Again, not everybody with EDS hypermobility has it. Not everybody with MCAS has hypermobility. But mast cells are an interesting sort of white blood cell. They're our body's first line of defense. Unlike most blood cells or all the other blood cells which are in our bloodstream, mast cells, a majority of them aren't in the bloodstream, but are in connective tissue. So that's probably the link. So they're in our skin, they're in our GI tract, they're in our bladder, they're in our lungs, they're in our airways. And so their job is to be in those places. So if a bacteria or other infection tries to get into our system, the mast cells are the first responders. They go there, they release chemicals that cause local swelling and inflammation to contain and bog down that infection, and then they call in other parts of the immune system to help neutralize the problem. So those are all very good things, but sometimes for some reason the mast cells start initiating an attack against things that are normal issues or normal contexts or just for no good reason. And so people can get problems with redness, itchy, blotchiness, hives with their skin. They can get a lot of GI symptoms from problems with the mast cells there, bloating, abdominal pain, cramping, diarrhea, constipation. A lot of what gets labeled as irritable bowel syndrome is oftentimes MCAS. There could be, sinus or allergy type symptoms with the nose and coughing. And the mast cells release histamine. They're known for doing that, but they release thousands of different, what we call mediators, different chemicals. And we're still trying to get our heads around what all these different things do. And many of these, or some of these mediators, can cause brain fog. They can cause flu-like symptoms. They can cause muscle pain. A lot of patients have what they describe as bone pain. They can cause urinary issues. They can cause weight fluctuations and brain fog and fatigue in particular. So a lot of times those symptoms that plague people a lot are related to MCAS. MCAS is similar to EDS in that there are diagnostic criteria. There are certain tests that can be done, but they're very often normal. So you can check levels in the blood or do a collection of urine and look for elevated levels of histamine, elevated levels of other mediators like prostaglandins, leukotrienes, blood levels of something called tryptase. And if they're elevated, those can help you and say, yes, this supports MCAS. Unfortunately, in a lot of patients, they may be normal even on repeated testing, and very often, like EDS, which is a clinical diagnosis, in my practice, MCAS is a clinical diagnosis, and there are treatments blocking histamine with antihistamines. There are medications, so-called mast cell stabilizers, and they can be very effective at treating those symptoms. And there's an interplay very often between the autonomic problems, between the mast cell problems, and even the connective tissue problems. So we think that having abnormal connective tissue over time throws people's mast cells off or makes the mast cells become dysfunctional. But then once they are dysfunctional, the mast cells, among those thousands or many mediator chemicals that they release, includes enzymes that can weaken connective tissue and break down connective tissue. So we don't know this, but we have concerns, and we wonder if some of these mast cells are particularly active and flaring, can that aggravate their MCAS, can that aggravate their hypermobility, their EDS, and make things worse and make them more prone to having problems.